Well, another busy week here at the Texas Capitol. Lots been going on. I want to apologize in advance. My voice is a little hoarse right now. I got a little bit of a cough going on. Probably a good example of why we need to let our pharmacist do these CLIA tests and other things, so I could just run down to the pharmacy, get this taken care of, since I don't have the time to get in and spend the time to wait to see a physician. So a lot been going on this week. NADAC came up in the Appropriations Committee on Monday. This bill's gone through a lot of discussion this session. NADAC, for those that don't know, is a number that comes from CMS. This number is a very clear, defined number about what it costs for you as pharmacists to acquire your meds. The big push, this is a bill that's been filed by TPA, is bring some transparency to the system. Right now, we all know how bad MAC can get and how difficult it is to make business decisions based on the pricing structure and the way that they are paying y'all today. There's been a lot of discussions amongst the profession about the dispensing fee, which is not in the bill. There is definitely going to continue to be a big push to educate the elected officials in the legislature about the need to make sure that when NADAC comes out, that pharmacists are properly reimbursed with an adequate dispensing fee to make sure that you're paid properly for the services that you are providing. It's important to note the bill came up on Monday and was actually voted out of the committee on Tuesday. Very, very fast pace on that bill to come up and move out that quick. And it's also important to note that the bill came out 24-0. That is unanimous support from the Appropriations Committee on that bill, which is really showing that a lot of elected officials, particularly those that know the numbers and know the budget, are starting to realize that pharmacists have not been treated properly under the shift to the MCOs. So we'll keep tracking that. We're going to continue the discussions. It's on its way to calendars. If you've got one of your elected officials as a calendars member, make sure that you reach out, let them know that you support this bill and that bringing transparency to the system is critical, and that also you want them to make sure that at the end of the day you get a proper and adequate dispensing fee as a part of it. Also came up this week, CVS has a bill that they've been pushing this session dealing with allowing pharmacy technicians to work remotely. Now, this would also cover pharmacists and pharmacist interns. Primary focus has been on the technician, and it would allow the technician to do data entry. It would allow them to access a database remotely. There's been a lot of discussion on this. The original drafted version had some concerns that we brought forward because it took the authority away from the pharmacy board to regulate this part of pharmacy. Instead, we suggested some language that would require that the State Board of Pharmacy establish rules to allow technicians to do this. This gives us a chance to work with the board and make sure that how this is going to go out into the future works for pharmacy and works within the current systems and is a benefit to you as pharmacists and to our technicians that are helping to support you. Also came up this week out of committee. A lot of discussions been going on over the session dealing with the bill that would allow a pharmacy technician to work remotely at a new class of pharmacy. Actually, this class exists today, but it's been under very, very limited use. The pharmacist technician would be allowed to fill and dispense the medication with a pharmacist in a Class A oversighting that pharmacy technician. That Class A could be anywhere in the state. That's a lot of discussion, as I said, has been taking place on that. The bill that came out of committee on Wednesday in the Senate would require, or limit rather, shall I say, that this new class of pharmacy cannot exist within 25 miles of an existing Class A pharmacy. In addition, the tech will have to be a higher standard tech than currently is in place. They'll have to be in place longer as technicians. They'll have to go through more training and education, much of which will be decided by the State Board of Pharmacy. As well as there is a limit that a Class A can have no more than 2 remote locations connected to the Class A. The ratios stay in place. There's been lots of discussions amongst all the organizations on this. Several of the organizations still have significant concerns. TPA has continued to weigh in and discuss these issues with the bill author and the lobby team pushing the bill to bring up our concerns and our issues to make sure that any bill that may come out of session works for pharmacy and works for you and is a method by which pushes the profession forward and not backwards. I want to bring y'all real quick up to speed on our House Bill 2608, that's the provider bill, and our HB 2444. Today's Thursday. The Public Health Committee posts for the next week's meeting on Tuesday today. Haven't seen a posting yet, but we're really hopeful and we're hearing that we should be posted for next week. I've said this in the past, I'll continue to say it. We need a physician that may be willing to come out and testify as well as a patient. If any of you know someone or have a patient or physician that you work closely with that wants you to have the authority to furnish medications under a collaborative practice agreement and to help you get paid for the services you can provide, please let me know. Reach out to me at TPA. It's important that we have that side of the profession of medicine come out and talk and not just have the naysayers on that side come out. Lots going to continue to go on. We're, as I said in the beginning, we're in the heading towards the end of session. Everything's picking up pace and picking up speed. Lots of bills still to come up, lots of issues that we're going to address. Want to end it on an important note. To date, physician dispensing has been yet to set for a hearing, which is wonderful news, but we're still in the third quarter. There's a lot of plays still to be made. We're going to be working closely to keep an eye on that and make sure that it doesn't come out of session. Keep posted, continue to watch, share with your friends, your family. It's only through you can we be effective in the Texas Capitol. Thanks, everyone.